All right, so I practice in New York City alongside with Dr. Goldberg here in private practice. I did my training in New York, and then I did my fellowship up in Boston with Dr. Avram, who's the other lawyer dermatologist. And during my fellowship, we did a review article looking at legal issues affecting minimally invasive cosmetic procedures. So I felt like it would be really highly relevant. There's a lot of good teaching points when we look at kind of everything that's been published to date in terms of minimally invasive cosmetic procedures. So there were two recent surveys by the American Society for Dermatologic Surgery and the American Society for Plastic Surgery, and we see that these procedures are just increasing by leaps and bounds. The millions of injectable procedures being performed every year, it's going up. Patients are starting earlier, they're getting more of these things done. We're getting new lasers, new devices, new peels coming out, so this is definitely on the rise. And as Dr. Goldberg was saying, there's all these medical spas and other types of non-traditional medical settings popping up. So with this rise of minimally invasive cosmetic procedures, there has been a rise in lawsuits that we've seen. And some studies estimate that about half of medical malpractice claims result in litigation. And obviously you want to avoid this for many reasons, other than the fact that it's just expensive and time-consuming and can be harmful to your reputation. So the real goal of this presentation is to look a little closer at these malpractice trends and the reasons for litigation to help establish some safeguards for patient care and ultimately minimize your liability. This was an interesting study from the New England Journal of Medicine back in 2011, and they looked at all medical specialties and the rates of facing your first claim or making your first payment, and they kind of divided into what they considered low risk and high risk specialties. For example, dermatology, which there's a lot of dermatologists here, is considered a low risk specialty. And I was kind of surprised to see that over a third of dermatologists were projected to face their first claim by age of 45, and that's almost 90% in high-risk specialties. And when we look at the rates of payments, only 5% in low-risk specialties projected to make their first payment by age 45, but by the age of 65, this increases to 20%, so 1 in 5, and in high-risk specialties, it's almost 7 out of 10. When we look a little closer at large databases of medical liability claims against dermatologists, we see that only about 1% of these liability claims are against derms, so pretty low rate. And most of the claims against dermatologists were abandoned, withdrawn, or dismissed, over 2/3. So some reassuring news. When we look at these reasons for dermatology liability claims, the most common are improper performance of procedures, errors in diagnosis, and medication errors. And when we look at the top 10 adverse outcomes that result in dermatology liability claims, a lot of these are highly relevant to aesthetics. We've got dyschromias, we've got burns of the face, head, or neck, we've got individuals who are unhappy with the results of their plastic surgery. So again, a lot of issues that are highly relevant to what we're discussing here at the conference. And we see this in the media, so patients are aware that if anything goes wrong, they can have potential to have a case on their hands, and you see these really high settlements that have been obtained. So let's take a look real quickly at malpractice litigation by procedure, and I'm just going to highlight some. Injectables we've got some pretty good data for, so I'm going to start there, and then we'll move on to lasers and lastly some chemical peels. The data sources that are used in these studies are largely the Westlaw and LexisNexis legal research databases. These have publicly available court records that you can review. Now, there are a lot of limitations with these databases, mainly that the majority of civil litigation settled outside of court and doesn't get to the point of actually being included here. It also fails to detect cases that are filed in small claims courts, and the data submission requirements vary. So we're kind of doing the best with what we have. There are a lot of limitations here. Dr. Goldberg already went over this, kind of the definitions of negligence. This is that duty, breach of duty, the injury, and proving that it was directly caused by infringement on your duty. The standard of care, this was an important point that Dr. Goldberg made as well, that the standard of care is defined as what a reasonably prudent and competent provider would have done if treating a similar patient. So this is established using clinical practice guidelines, position statements, peer-reviewed articles, and texts. And lastly, informed consent is making sure that the patient or individual has enough information about their treatment, the risks, potential risks, benefits, and it really is a discussion between you and the patient. Should not be confused just with having a consent form that doesn't entirely cover yourself. So let's start by looking at neuromodulators. There was a study, this is the one largest study that we have. Unfortunately, it only included cases through 2012, and since that time we've had newer neuromodulators hit the market, and obviously many, many more millions of treatments. They had identified 24 reported cases, 17 of which were part of a mass tort, and Allergan, the creator of Botox, was named as the defendant in all the cases. But again, we take a look at the years of study here. It was only until 2012. There were 5 times as many lawsuits involving therapeutic use as compared to cosmetic application, so that's reassuring for those of us who use it cosmetically exclusively. Overall, 10 of the claims were dismissed. A settlement was reached in 6. And of the 5 cases that were tried before a jury, only 2 were decided in favor of the plaintiff. 1 was pertaining to cosmetic use. The settlement was $15 million, and it was for a patient who had symptoms of systemic botulinum toxin, and they had muscle weakness, pain, respiratory problems. And then there was one other case with therapeutic use where the individual had a severe immune reaction and brain injury. When it comes to neuromodulators, there's millions of treatments, and we see a very low rate of cases of civil litigation here, more commonly with therapeutic neuromodulators. So they're using higher dosages, and these patients often have other underlying comorbidities. But it is important to review the potential risks, especially the risk of systemic involvement from distant spread and withholding treatment in the setting of any known contraindications. What's also important is if you're administering this for cosmetic purposes, inquire if the patients are getting any other treatment for migraines or therapeutic usages, just to make sure that you're staying within a safe dosage. When we look at fillers, again, millions of these procedures being performed. The safety profile is generally favorable, especially with the hyaluronic acid-based fillers, but again, there's a high variability in the provider training and experience, so a lot of different individuals are administering these treatments. One of the earlier studies was looking at the Westlaw database through 2013. They had identified 19 cases here. 50% of the legal actions in this study were from non-physicians performing the procedure. And one of the main reasons is that an incident happened and a physician was not present while the non-physician injected patients, and this was most frequently in a medical spa setting. I'll have a summary at the end, but I just wanted to highlight a few points from each of these studies. There was one pertaining to specifically facial soft tissue fillers, so there's going to be some overlap between the cases that are included in each of these studies. But in this one, there were 9 cases. 4 had resulted in payment, 2 favoring the plaintiff, and 2 that were settled. What's important to note here is that 2/3 of the cases alleged inadequate informed consent, and half of these had resulted in payment. 5 of the cases sustained an alleged permanent injury, so that's going to be important to talk about. 2 where there was an intra-arterial injection, and 1 that had resulted in blindness. And lastly, in 5 of the 9 cases, plaintiffs alleged that the filler choice or procedure was not appropriate or contraindicated. This is the 3rd study looking at filler litigation, a summary table here. They had identified 11 cases. We can see the different fillers that were used here. Most of them are hyaluronic acid-based fillers, but we've also got calcium hydroxylapatite, we've got polylactic acid. The important takeaways here are that of the ones noting location, the majority were in the periocular region. We can see there was 1 case of permanent blindness with injection of Juvederm in the temple, and that had a settlement there. And then we can also see the ones that alleged a lack of informed consent, and that was 10 of the 11 cases here. So informed consent, overall we see there's extremely low rates of successful litigation as it pertains to fillers, just given the number of these procedures being performed. But the majority of lawsuits and the majority of those where the plaintiff won the case had alleged a lack of informed consent. And with these fillers, again, very safe in general. There's many common temporary side effects that can arise, like bruising, pain, swelling, nodules. There are rare complications, vascular occlusion, blindness, scarring, nerve damage, and those are the ones that get raised in lawsuits. So it's important to counsel and have this included on your consent form for any serious or potentially permanent risks, and go over that with your patient during the consent process. The provider who's administering the treatment should really be the one obtaining informed consent, and you should obtain informed consent before each treatment, even if it's a repeat procedure. Having a written disclosure of the risks and having that clearly delineated either in bold or in capital letters on the consent form can help enable better retention and understanding for the patient. If you have any witnesses in the room, it's helpful to have them also sign the consent form. And informed consent allegations may even stem from a patient's expectations not being met. Whether that holds up or not, that's up for debate, but I think it's really important to discuss the goals of the procedure and the plan to follow if the expectations are not met, because here the goal is to just even avoid getting yourself faced with any sort of litigation. Knowledge of your anatomy and safe injection technique is critical, and this is kind of where, if you're overseeing any mid-level providers, it's important to note that this may increase your exposure to litigation, and that's what we're also seeing in the cases as pertaining to lasers and energy-based devices that we'll talk about in a second. This is under the tenet of vicarious liability, where the physicians can be held liable for failure to adequately supervise delegates if they're administering treatments in their office. And the standard of care in non-traditional settings, so medical spas, is no different from the standard of care in medical offices. We'll switch to lasers and light-based energy devices. So obviously we're seeing more and more of these procedures, more devices coming out. We're seeing different providers of different levels of training administering these treatments, and we are seeing increasing litigation alleging malpractice. This was one of the earliest studies by Ray Jalian and Matt Avram looking at the Westlaw database through 2012, and they found an increasing trend in cases of litigation as it pertains to cutaneous laser surgery. Most cases cited a plastic surgeon doing the treatment and then followed by a dermatologist, but we can see a lot of other specialties listed here. And non-physicians, chiropractors, podiatrists, nurses were the laser operator in almost 40% of the cases. And although the physician physically operated the laser in only 100 of the cases, they were named as a defendant in 146 cases. The most common procedures, Dr. Goldberg had mentioned this, hair removal, IPL, those are the most commonly performed treatments. They're also the most commonly performed in the medical spa setting. And so as just sheer numbers, they end up making up most of these procedures here. But we can see vascular lesions, leg veins, tattoos, all causing injuries, the most common being burns, pigmentary alterations, and disfigurement. And the most common cause of action in these cases was a lack of informed consent. So we're seeing a common theme here. Others had alleged emotional distress, decreased quality of life, and embarrassment. And here we saw in this study just over 50% of cases had resulted in plaintiff recoveries. There was a follow-up study that wanted to look specifically at the litigation with non-physician operators, and they ended up finding that 43% of the cases in this study were performed by non-physicians here, and they saw that there was an increasing incidence of these cases, citing non-physician operators. Laser hair removal, again, was the most common procedure, and most of these treatments occurred outside of the traditional medical setting, again, salons, medical spas. So this comes down to your failure to supervise or train and hire appropriate staff. There's one study looking specifically at ablative laser surgery. There were 42 cases identified. Again, we see inadequate informed consent being the chief complaint here, as well as inappropriate treatment being alleged in almost 20% of the cases. Adverse effects that were cited were scarring, followed by discoloration and infection. And then, there was one other study that looked at skin resurfacing procedures. Again, we see negligence, deformity, lack of informed consent. 4 of 9 had ruled in favor of the plaintiff, 1 of 2 against a dermatologist, and then there were other medical specialties that were cited as well. So here's just a brief summary table of those last 2 studies here. We see that skin scarring, necrosis, those tend to be the ones that are the most frequently cited complications. Lack of informed consent in 2 of these, and you can see the award monetary value that was paid out for these different treatments here. So protecting yourself, again, inadequate informed consent is the leading cause of malpractice litigation as it pertains to lasers and energy-based devices. the failure to warn or inform of risk, failure to select appropriate settings, and the failure to recognize or treat injury. So you want to make sure that you are readily available. If a patient ever has an adverse issue after their treatment, if they've got concerns, and you make yourself available and you act in good faith to help them fix whatever may have happened, that can help protect yourself because you're really building that rapport with that patient and looking out for them. You're treating early and intervening. In terms of laser safety, there were 4 cases of eye injury, proper eye protection for the patient and provider, perhaps having a checklist just to double check everything is important. And then scope of practice and standard of care. The providers who are not specifically trained in the use of medical laser devices are held to the same standard of care expected of physicians trained in delivering these treatments. So if you are looking at providing any treatments outside of your traditional medical training, it's very important to seek out requisite training and or licensing to show that you have the credentials to use those devices and you know what you're doing. And lastly, that tenet of vicarious liability, again, you need to know your state laws regarding physician supervision of non-physician operators, and this varies on a state-by-state basis. As Dr. Goldberg said, we've got nurses who operate lasers in New York, and then you cross the river in New Jersey, it's a whole different story. We'll just end on chemical peels real briefly because there were a couple points here I wanted to highlight. More complications are seen with the more aggressive, deeper chemical peels. In this study of peels and dermabrasion, they didn't separate it out. There were 25 cases, most occurring in the hands of plastic surgeons, followed by dermatologists, but we can see family practice physicians, ENTs, other specialties listed. In general, most cases favored the defendant, but about a quarter had favored the plaintiff, and we can see the different rates of payments based on peels, dermabrasion, or combined cases. And the main allegations were poor cosmetic result, negligence, permanent injury, and deficits of informed consent. So again, some key themes here that we're seeing. This was a little summary table that I had made looking at just a few of the different devices that were used. Sorry, it says laser there, but it should be peels or abrasion, dermabrasion. We can see infections, depigmentation, scarring. Those tend to be the most commonly alleged complications. And inadequate informed consent was cited in 4 of these cases that had positive payouts in favor of the plaintiff here. So in terms of protecting yourself, you need to explore the patient expectations, discuss the potential need for repeat treatments, and be available to intervene early if there's any adverse effects. Something we do is use different consent forms that are unique to each procedure being performed. You want to be very specific and avoid medical jargon on your consent form so the patients can't say that they didn't understand what purpura means or what necrosis is. You should use very plain terminology that's easily understood by the patient. And then in terms of poor cosmetic outcome, it's generally accepted that a poor result of treatment in itself is not evidence of negligence as long as you prove that you acted as a reasonably prudent provider performing an accepted technique that's commensurate with the standard of care. Again, you want to avoid any threat of litigation altogether, so it's really important to assess the patient's motivations, their desired result, tell them what's the roadmap going to look like if you don't meet their expectations, or that it can take multiple treatments and what the future plans would be. And lastly, I just think it's really important to obtain patient feedback during the treatment just to make sure that they're not having any exceedingly high levels of pain, or I always show patients in the mirror so that they see exactly what we're doing, and I like to document that at the end, that they assessed throughout the treatment everything that was happening. So knowing potential complications and their management is important. Being available early to help manage complications and provide reassurance is also important. So these are just a few of the key points. I think I'm well over my time here. I'm going to turn it over to Kai Chu here and be available for questions at the end. Thank you.